try again. What? That's really weird. That has never happened. All right, we're going to try again.
Okay.
Hello and welcome to this really exciting episode of Akrinos Access. Y'all know me. I'm Erich Mattei, President and CBO of Akrinos, joined today by Dr. Kara Foster, who some of you all may have heard of. Dr. Kara Foster is the founder of Direct Care Difference, and we're going to jump into a really insightful conversation today all about growing a direct access optometry practice. We've got so much to get into, so let's go ahead and jump right into it and start by just welcoming Dr. Foster to this episode of Access. Dr. Foster, welcome. Thank you so much for joining us.
Thank you so much for having me, Eric. I'm really excited to be here and excited to share some good tips, and I appreciate you having me today.
Absolutely. Likewise, we're so honored to have you here. And the reason for that is because, let's face it, I mean, we are here in this episode of Access. We are basically going to call out the elephant in the room. And the elephant in the room in optometry these days is absolutely these vision care plans, and the degree to which they are it's kind of wreaking havoc on so many stakeholders, doctors, patients, practices. So really excited to debunk some of the myths out there and really learn some ways that practices can get away from being so reliant on these vision plans. So Dr. Foster, again, thank you so much for joining us. And why don't we go ahead and kick this off? Would love for you to just share with us a little bit about your background.
Well, I'm originally from Pennsylvania. I went to optometry school in New England College of Optometry. I graduated in 2009, and shortly after that was when I moved to North Carolina. And I practiced in a private practice optometry group for about 6 years. And I really decided, first off, my daughter was born in 2013. And that's kind of what got me thinking about a way to find better work-life balance. You know, we had a really great practice that I worked at, but it was just busy, always trying to see more patients, working Saturdays. And I wanted to see if I could open my own practice and be a little different. So 2015, I opened my own practice called I Care for You. After that, I was taking insurances, and I just figured that I needed to find a better system. Before, when I had worked in another office, I didn't really know the back end of insurance companies. And once you start being an owner and you're finding out all the back end of insurance, you've got to figure out if there's a more sustainable way. So that's really kind of what facilitated all of this. So
that is fascinating. I think there's a couple things that you tossed out there, two in particular that I want to call out. One is looking for the work-life balance. Right.
Yes.
And the opportunities to achieve that on your terms in practice ownership. And then that leads to number two, a word that you tossed out there that, as our viewers know, we at Akrinos are huge fans of, and that is sustainability. And it's sustainability in all things, right? I mean, obviously sustainability of this beautiful planet we live on, but particularly sustainability of the business. Right. So I'm really fascinated that what kind of tipped off and kicked off your interest in abandoning these vision plans was about a more sustainable way to run your business. That is absolutely amazing. So, but also let's put it in context, because you mentioned that you started your practice, your cold start, right, from the ground up with these vision plans. So why don't you share with us a little bit about what that was like those first couple of years when you were working with the VCPs and then kind of realized you wanted to approach things a bit more sustainably?
Right. So I guess as a cold start practice, especially if you've worked in or even done any research in opening a practice, that's kind of what you're presented with as your option. Your cold start, the only way for patients to get to know you is through their insurance company's website. You kind of feel like you're pushed in that direction and that's what everybody does. So if that's what everybody does, then that's the way you should do it too, I suppose. So I did start because that's all I knew. I didn't know anything else. And then, it was 2 years after that we dropped all insurances. But when you're first starting, I mean, people who've started cold start know, I mean, you don't have a lot of income coming in, and it's frustrating to get those really pitiful insurance reimbursement checks in, if you get them at all. And then, you know, trying to navigate the whole kind of back end system there. After a while, I started realizing that I just didn't like, you know, I don't want to be like nickel and diming patients. I don't want them to feel like they're being pressured while they're at their office. And I didn't like the idea of opening an office where I felt like I was trying to sell people a pair of glasses because I had to. I wanted to just truly give the best customer service, the best patient care. And I think really that's what creates that work-life balance, because you're happier going into work that way. You don't have to cram all your patients together. You can kind of space it out. So I wanted to find a way that I could make that work. And it just didn't seem like it. Once I really got to know the back end of the insurance companies and how it worked, and even with using glasses through the insurance labs, it just didn't seem sustainable, like you said. So I thought, what can I do? And I thought, why don't I try and see if I can just drop all insurances, do it as in a positive way. I mean, it's not about the negativity of, oh, their plan doesn't pay enough, but more just, we're doing this because we don't want to have to practice in the way that the insurance companies are kind of directing us towards. We want to separate and be a little different. We're doing this because we want to have good patient and customer care. And so I thought, you know, if I'm going to be working for somebody anyway, like the insurance company, you know, and I might as well give it a try and see if I can drop all insurances. So we did, and it's been 8 years. It's been wonderful. So
that is absolutely outstanding. I think something that's important to call out there is, you mentioned that you did it for the positive reasons.
Yes.
Not for the negative reasons, right? Like, and I think right now part of the narrative around the industry is getting away from the vision plans for the negative reasons.
Right.
And I really like how you embraced it, because it's all about empowering you as the doctor and empowering patients in your community to do business together on you all's terms, rather than on the terms of the vision plan.
Yeah, absolutely. Yeah. And I think it encourages, sorry, go ahead.
Oh, no, please share a thought.
Well, I was just going to say, I think overall too, like if we can do this, it will not only empower private practice optometry, but also just the healthcare system in general, because the more people that can do this, especially if you're offering fair prices, I'm not talking about, you know, these exorbitant exam fees that it looks like doctors are charging, and we know that they're not really, but if we can just be upfront and honest with pricing, I think overall this can slowly start transforming healthcare across the board. So, because the longer time you have, the better relationships you have with your patients, the better relationships you have, the more they trust you and take you. So, I mean, it can expand even more into primary care and other areas of healthcare that I think this is just a great stepping stone for a lot of things. So.
Absolutely.
Yeah.
And you know, Dr. Foster, the fact that an optometrist is someone who's really rising above, and you said that you're looking to have an impact all of healthcare, not just optometry, but the role of managed care and these vision care plans, the role of managed care in optometry is huge. It's really exciting also to hear you say that part of this inspiration that you've got, this drive you've got, is also to have an impact not only there in your community and serving your patients, but the ripple effect, right? And changing healthcare.
Yeah.
But before we go any further, though, I do have to ask this. Were you afraid as you were starting to make that step, right? Because to put it in context, you were 2 years into the business. If my math is right, also, you guys had small child or children by the time, right? And I know you guys have 3 amazing kids.
Little ones.
So was it scary? Was it scary when you were ready to do this?
It was scary. It was scary because I didn't want to, sacrifice something that I had worked so hard to open. I just figured, I just felt like if I could explain it in the right way to patients, then they would understand and they would want to keep coming in. But yeah, I mean, I did think that there was a chance I could be looking for a job in a couple months. So I didn't tell my team that at the time, but pretty happy in the back of my mind.
Love it.
And even, I mean, I've been very fortunate that people are understanding and want to, but yes, so it was a little scary for sure. Absolutely.
Absolutely. Yes. And thank you, by the way. Thank you for sharing that, because I think it's important to our viewers out there. I mean, look, y'all, we've heard it directly from the source. Dr. Kara Foster, arguably the biggest name in going vision plan free in modern optometry, the biggest name, just said that she too was scared. So if you're listening to this,
it's scary.
And you're a little nervous, a little scary going in, it doesn't matter. You're in good company. So now let's really jump into the facts, right? And really, Dr. Foster, I want you to educate us and all of our viewers, for starters, on just give us an overview of what is direct access care.
I really like to see it as like simplified eye care. And it's like that across the board, and maybe direct primary care too, but it's just simplifying healthcare so that patients pay the doctors directly. You do not get any bills at your house, which nobody likes to get. It simplifies your recommendations, because if you want to see a patient back for a follow-up, you don't have to charge them, say it's going to be a quick 5-minute follow-up. You don't want to charge them the medical health care or the medical copay. I feel like it feels like an honest way to practice. Not that the other ways are not, but it just feels like you can do the way you want to without having to navigate the insurance company. It's just simplified, and patients appreciate that, because there's so much confusion in healthcare. When you can simplify it for them and put out there with your basic fee structures, they know what to expect. It makes it a lot easier, I think. So
absolutely. It's so refreshing to hear you say that, right? It's about simplifying the business dealings between the practice and the patient. It's also something else you mentioned: honesty. And honesty and integrity in business and in healthcare is something that I think it's up to our generation to bring honesty and integrity back into business and back into healthcare. So it's tremendously refreshing to hear you mention that. So now let's talk about the significance of this stuff to the practice, right? Because obviously, we've got vision plans, we've got a direct access model. Maybe speak briefly just to the significance of each to the modern practice.
Say that again. The significance of.
The significance of the vision plans to kind of the conventional practice, and then the significance of a direct access approach to that practice that wants to modernize their approach to working with patients.
Well, I think that just with the vision plans, there's really no way to spend the more time with patients that they appreciate. And I have really found that that's one thing that patients tell me when they come back time after time, is that they appreciate that I spend more time with them and I really listen to their concerns. But I think that when you're in a kind of the loop of being stuck in the vision plans, it's really hard to be able to spend that time, because you have to get out there and get them into optical. You have somebody else waiting. I book my exams for an hour, maybe 30 minutes if it's a kid. But for the most part, we spend a whole hour with people, and I don't have to have a technician. I can really explain what I need to explain and really listen to them and connect with them on a different level. That's not just like you're in my chair for 10 minutes and then you're leaving. But I also feel that there is an opportunity for private practice optometry to kind of go in that direction. I think it is, if we try in private practice to keep up with the vision plans, and it kind of leads us down this corporate spiral. And that's not why you opened your practice as an independent. You want to be independent and you want to have a different kind of practice. But if you're in the network with insurance companies, then you're just going down that rabbit hole, kind of chasing whatever you can. And the insurance companies aren't trying to help you out. They're trying to help out, their companies too. So I think this is a way for private practice to also set ourselves apart and really go in a different direction with optometry.
So powerful. The first thing you mentioned there was the timepiece and the degree to which you see the level of care you're capable of delivering, right?
Yeah,
and
everybody
the value.
Yeah.
Right. Yeah. The value to the patient. And, Dr. Foster, as you know, we've spoken offline about this. I'm a huge fan of the emerging research that's now coming out around consolidated healthcare systems, right? If we look, and here we are recording this It's August of 24 that we're doing this live recording. We are now about 15 years into the mass consolidation of healthcare. When we talk about mass consolidation, we're talking about the delivery of care. So think of private equity, corporate healthcare, the growth of these hospital systems. We're talking about managed care, and we're talking about the supply chain. And it's fascinating to see that as we've seen more and more consolidation around healthcare, now the literature, and there's a couple of amazing, there's a think tank out of Harvard Public Policy Research Center, as well as out of UC Berkeley, some amazing research is being done that's actually looking at, as we're seeing more consolidation in healthcare, how is it serving stakeholders? And we all know what the facts are. And the facts are this, y'all, is we have seen more corporatization and consolidation of healthcare. Physician burnout rate is through the roof. The cost of care continues to climb. And the overall quality of care is on the skids. And what's fascinating is that when you do dig into the research and see how private practice compares, private practice is outperforming industry benchmarks, national benchmarks on all fronts. The rate of physician burnout is lower, the cost of care is lower, and that patient experience and quality of care is radically higher. So I love hearing you mention how you are seeing your stakeholders, your staff, your patients, your community benefiting from this. Really, really powerful. So let's now maybe jump into talking about some of these unique aspects of vision plans and direct access at different phases of the practice life cycle, right? I mean, Dr. Foster, you mentioned for a cold start, can be very inviting to sign up with a bunch of vision plans, right?
Yes.
But let's kind of look at it from all steps. I mean, what does this mean for a cold start, for a recently purchased practice, practices that are actively growing in scale? And would love to get your thoughts on some of those concepts.
Yeah, sure. I would say, especially having to transition a practice. Now, my practice was only 2 years old, so that probably would be easier than a practice that's been around for a while. But I would say it would be easier to start a direct care practice as cold start or a recent purchase, because your practice is already going through a transition. So you have the opportunity to kind of explain to patients the reason why you're doing it this way. And you're always, it was a little challenging because it was a little challenging because I had patients who asked me like, well, why are you dropping my insurance? Is it just about the reimbursement? And I think we were able to really do a good job of keeping it positive and explaining it wasn't just about the insurance. It was really about us being able to continue the level of care that we thought that they deserved. I do feel like that'd be a little bit harder because you'd be answering that question so many times when you've gotten a growing practice or, transitioning a pretty large practice. But I also think that there's an opportunity to make the practice the way you want it instead of, very busy practice where, we're busy, but not to the point that you're like getting run down and not enjoying it anymore. You want to be able to enjoy coming to work and spending your time with people. And now when I see patients, because I have time to see them and chat with them, it feels like I'm seeing old friends, and I really love that. But I think that for a growing practice, just explaining to patients the positive reason why you're dropping their plans is important. And I also think it's important for a doctor who's transitioning in that way to realize that you can actually lose a good amount of your patients and still maintain a high level or even higher level of revenue. Our patient revenue per patient went up significantly. And then even if you charge a very reasonable fee, I think say like $109 for a new patient, you can lose think about your reimbursements. You could probably lose 2/3 of the amount of patients that you see right now and still have the same. So if you see a little bit more and then you're not having to pay for chargebacks from labs, even though it seems like you might be losing a lot of patients, it seems like you could potentially, I don't think you'll actually lose a lot of patients, but in the mind, I think of doctors trying to transition over, it seems like that's a fear, whereas you technically could lose quite a few patients and it wouldn't actually affect your bottom line. Yes. Apart from making you happier in your day to day, the people who you lose are the people who, run you around all over the place and you don't get a lot of revenue from anyway. So the people who really appreciate you are going to keep coming back. They understand why you're doing what you're doing. Your prices are fair and reasonable. And I can't tell you how many people, even who thought that they needed to use your insurance plan, maybe left for a year or two and have now come back because they remember the level of service that we have and they want to keep with that. So, and I really appreciate that. So, and I tell them too, and I understand, I tell people I understand why they may have left, and come back again. So yeah.
Absolutely. That is so powerful and so refreshing for you to hear. I think there's a couple things that I wanted to call out there. One of which is looking at the pure economics of this.
Mm-hmm.
Dr. Foster, I think if you think back to one of our conversations when our good friend Steve Alexander at Anagram had first connected with us a few years back, and you may think back to one of those early conversations you and I had. I shared with you the first time that a doctor kind of showed me behind the scenes of the EOBs and kind of all the economics of that. And it was mind-blowing. It was mind-blowing and mind-numbing at the same time to really consider the degree to which practices and patients, and dare I say also employers, right? Because it's typically employers that are doing, providing the vision plan as an employee benefit. But it's mind-blowing and mind-numbing to consider the degree to which the vision plans are really the puppet masters of doctors, patients, and employers. And when we assess the economics of this, we realize, wow, there's an entity that's getting rich that's not even really a part of the community, right?
No,
I mean, if we think about it, this all ties back to keeping the benefit in the community, right? Because you're mentioning the revenue per patient. You're mentioning, sometimes what I think is for some doctors and at times for the profession, a difficult conversation to have, and that is profitability.
Yeah.
Profit is an amazing thing. If it weren't for profit, we couldn't pay the employees to help the living wage. Let's pay our employees top dollar. Let's give our employees the types of benefits that we want to be able to give them. Let's provide care to patients. Let's donate. We did a live stream just earlier this week. We had Optometry Giving Sight was on with Dr. Stephen Rice up in Missouri. He does amazing things supporting OGS. But it's like, if we don't have a profitable practice, we can't serve others.
You can't serve others.
So I love hearing you. I love hearing you bring up.
Right. I mean, obviously, it's not just about profit, but it's all really about the healthcare. But like you said, you need to be able to have that profit to be able to serve your patients better. And I was fortunate enough to be able to just take a week off, and we went to Guatemala and did eye exams in Guatemala. So it's wonderful to be able to do stuff like that. And I also like to hire employees who are just amazing, and you can't afford to pay amazing people if you're just going, scraping the bottom of the barrel. So that all makes a difference in the patient care too, I think. So anyway, I love to be able to do stuff like that. So
love it. Okay, so, and by the way, I hope we're good on time, Dr. Foster. Because I realize we still got a number of things to get to, and what an inspiring, truly, and for our viewers out there, I'm sure everyone's kind of with me just right now. Tremendously inspiring to hear Dr. Foster's story, her vision, and what she's done. So now let's jump into the source of the fear for everyone, right? And that is, okay, let's face it. I mean, by a show of hands, if we were to have 100 optometrists come together by a show of hands, hey, how many of you would like to be able to no longer work with the vision care plans? I think probably everyone's hand would go up, right? Even those that are the premier partners for some of the big vision plans, right? So let's now shift gears into the how. So maybe share a little bit for those that are like, you know what? I am ready to do this. I'm ready to do this. Coming out of this live stream with Dr. Foster, I'm ready to do this. What are some of the key areas of consideration for going direct access? And maybe the starting point is, I know for a lot of doctors, and Akrinos gets out practices all the time coming to us, and well, this is how we've come to working so closely with you, Dr. Foster, Direct Care Difference, where they're like, hey, Akrinos, we really want to ditch some of these plans. Where to start, Dr. Foster? Where does it start?
Well, what I would do, and what I did at the beginning too, is create a fee schedule that you can even compare it against, like, if you saw this many patients, how many patients would you need to see under the insurance plan, and figure out what is a fair price that patients are willing to pay, that you as a patient, think about yourself as a patient, that you'd be willing to pay, that would also be fair to pay. Don't even think about like what insurance company is like chart or what the reimbursements are or what. Just think about what would be a fair price. I like to include OCT screener and fundus photos with my exams because patients like to see it. It's something I can pull up every year and show them. It adds extra value to, with really not taking any extra time on my part. So I think that coming up with a fair fee schedule is first off, make sure in your mind, that it's doable. See how many patients you theoretically could lose if you even lost any at all. And then coming up with like a timeline of at what time do you want to do this? Because then you have an opportunity. I mean, you don't have to do it tomorrow, but come up with the fee schedule, be transparent with your fee schedule, make sure it's available to your patients on your website, I think is important. I also sent out a letter to my patients letting them know why I was switching over to a more positive kind of direct care system. And I also think that team training is important too, because you're not going to be the one to answer the phone when they call. So your team has to be really on top of making sure they explain it in the positive way, not just like, no, we don't take your insurance. Nobody wants to hear the word no right away. And we are also kind of gotten in this culture, as a society, of thinking that we can only go to people who take our insurance. So I also think that with direct care, if you don't take any insurances, then it gives them a second to pause and think, wait, well, why don't you take any insurances? Like, can I still go there if I have insurance? And then it opens up another door versus like just calling and say, how do you take my vision plan? And you hear no. Okay, well, I'll call the next person. We have that script ready that we can explain to patients why we don't. And we don't necessarily even say no right away. I don't like that. I like to say, we're a direct care practice. This is why we're a direct care practice. And we still file, like you mentioned, Steve, with Anagram. I've been working with them for a while. They, with Anagram or there's other ways too, but you can file insurance for patients. It doesn't take any time at all. And it's a service that you can do for patients that they don't need it's not any extra work for them. So as long as you're not creating extra work for patients and you can explain the value of it, present that as number one, and then I think it makes it a lot more mentally accepting for patients, sort of. So, yeah.
So many pearls there that you just dropped, Dr. Foster, and I think the first one that I wanted to point back to is really how you opened it, and that is come up with your price, and in so doing, there were two key things that you mentioned there. One, think of what you would want to provide in your comp exam, right? Because right now, the definition of the comprehensive exam under the VCP is boom, 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 to be able to submit for the claim. But you mentioned it yourself. Now you have the freedom to say, well, that's not a comp exam. I want my comp exam to include, as you mentioned, OCT and fundus photos. Right. I know there's some amazing, to start jumping into the weeds, we could share probably stories all over the map of doctors who do really cool things. Yeah. Like, this is a part of my exam. This is a part of my exam. So number one, come up with those components of your exam and then come up with what you believe to be a fair price for that. Something else that you mentioned that is huge, transparency. Price transparency. Get your price on your website. Don't keep it a secret. Broadcast it to the world. Dr. Foster, may I ask on this live stream that's being broadcast across the galaxy, the galaxy, what are the prices for an eye exam with you at your practice?
We charge $139 for a full exam. That's not what we started off. Really, we've only raised our prices once in the last 8 years. We probably could have raised them more. We started off at $129 for a full exam. We do $109 for kids and like we call it like a Medicare or a senior discount. so we do 109 for kids and then 139 now for a regular established patient, new or established. So 139 includes everything. They need to come back for an RX check. We're happy to see them. We tell them we want them to come back if they have any problems. We want them to tell us that we want them to be happy leaving our practice. So we're there to support them, really. So
that is outstanding. And may I also ask, what are you doing above and beyond in your exam that the managed care plan wasn't going to be providing for the patient?
Yeah, well, I mean, I do a lot of just talking to people about their kind of lifestyle and what they're using their vision for. I'll even have them take computer measurement, like measures of their monitors, or I just go through what they're using their eyes for and kind of talk them through everything. Depending on the person, I tailor it, which is nice. I've got the time to do that. I'll do like a trial frame and have them walk around the office. I'll set them at a computer and put the prescription in. I've even had a guy brought his archery bow in and like right after hours. So, and like we took some measurements for that. So I think just having the time to customize and troubleshoot for patients, they really appreciate that. Not everybody is the same. But when you have only 10 minutes, you don't have time to get into that. So, and I think that's how word of mouth spreads too, because when you can help solve problems for people. And that's one of the great things about eye care. We can help solve problems for people. We use our eyes all the time. It's really important. So
yeah, absolutely. Absolutely. Yeah. Love this. Wow. How insightful. I mean, really, really powerful stuff. Okay. So now as we're talking about this, now let's maybe jump into some of the best practices, right? So we kind of think, so again, really great insights on how to make the step, right? And making the step is, it starts with self-reflection and think, what would I want to provide in an eye exam if I, as the doctor, was dictating what is in my exam, not some corporation that just wants to make money off of my patients, right? But what do you, as the clinician, truly want to provide? Then from there, building the price on what you believe is fair price, right? Then the third piece is broadcast it to the world. Right. And you mentioned that patient communication piece. So now let's maybe talk about some of the best practices. So now let's think of someone that has made the move. They are direct access. Let's talk about some of the best practices moving forward with the business.
Well, I would say just maintaining the level of like a really high level of customer service. We try not to have like a lot of paperwork, because I guess even from the very beginning. So like I think about it from the whole process, from when the patient walks in the door. We know who we expect to come in around a certain time. So we can say, hey, so-and-so, you're here for your appointment, make them feel welcome from the very beginning. When we don't have a lot of paperwork for them to do, we ask, because obviously if I've got that time, then I'll go through their history in the exam room, and they don't need to sit there for 20 minutes filling out paperwork or filling out their insurance card information on a piece of paper. So we'll just review their address information with them. We put them straight into the pre-test room, and then I notified when they're ready. I come up and I get started with them. So, and I kind of like talk them through everything we're doing. I wouldn't say it's probably, apart from like the extra stuff that I do in the exam, it's not like a whole ton different. I'm just chatting with them. I'm not letting it get weird. I have always, from the beginning, I think because it's my practice and my team feels this way too now though, that it's like when people come in, it's like, how would you treat people at your house? You wouldn't just let them stand there at the front, not paying attention to them. You would talk to somebody who came in. So we just kind of treat patients like that and maintain that good customer service throughout, even transitioning them into optical. It's not like a awkward, they don't ever feel like pushy. I print out their prescription in the exam room for them, so they don't have to feel like they have to buy from us or they have to ask for it. But I do kind of a transition to optical, and, we talk about what we had talked about in the exam room. I transition them to explain that to the optician when I'm handing them off. And then they just kind of maintain with the same level of engagement that I had too. And I think that patients just really sense it. So I guess I would say maintaining that through every step of the exam is important. And then also just keeping the conversation positive. It's always important. I mean, I think people like coming in here to see us, and it's nice to have that feeling. So
yeah. Love it. Love it. So many amazing things. Dr. Foster, I tell you, it's really impressive how you have taken this concept of direct access and it really made it happen in your practice. And through it, coming to develop, and what I'm super pumped for you to now share with us is tell us about direct care difference. And for our viewers out there, if you had not prior become familiar with Dr. Kara Foster or direct care difference, Dr. Foster has taken her concepts that she spent the last many years building and developing, and actually has launched a business, a program called Direct Care Difference that is there to empower doctors of optometry to make it happen for themselves. So, Dr. Foster, why don't you share a little bit about Direct Care Difference, what inspired you to create it, and then also the solutions that you guys provide?
I think the inspiration came during like the lockdown and COVID, when there was just so much fear and negativity that was out there. You see on social media, people are so worried about optometry and the future of optometry. And, it's hard even now going on. You see how people are afraid. And I kind of thought I have a system. I've been doing it this way. It would be great to be able to share this with others. I'm not trying to make it crazy, but I wanted to put what I do together in a easily accessible package that I could let people study and research and kind of go on their own, and also be there to support people too who do it, because I really think that improving the healthcare system, it's good for patients, it's good for work-life balance, it's good for your own mental health. You enjoy coming to work every day. A lot different than if you have 35 patients on your schedule and you're just trying to hustle through them. You don't enjoy that time with them as much. So it was very important to me to help move private practice optometry in a way in the direction that I would want my kids working in my own practice. Whereas I don't know that under the insurance model, I wouldn't want to recommend this profession to them. But now I would love to have, one of our girls come and work with me at the office. So they're still figuring all that out, but I wanted to create a practice, and I want other private practitioners to be able to figure out how to do that too. So that's why I put Direct Care Difference together to have that information readily available. So
That is, Dr. Foster, that is super powerful. That is amazing. So,
yeah, so it's wonderful. Yeah, I have the team training available, and then all the scripts that we had, tried and true and really refined over the years. And it took a while to get them exactly the way we wanted them. And I feel like we have a pretty good method that we do, and it was just kind of putting our method down on paper and making available for people. So.
Fantastic. And folks can learn more at your website, directcaredifference.com.
Yep.
Check it out. And Dr. Foster, I've got to say also on behalf of Akrinos and the Akrinos clients that you guys are coming to work with, I mean, it's amazing. I mean, it truly is. And to our viewers out there, to our listeners, we at Akrinos are seeing firsthand the impact that Dr. Foster's program, Direct Care Difference, can have. I mean, heck, Dr. Foster, just this week, I think we introduced you to 2 or 3 Akrinos clients. Sure. And it's like, like this is we need to get you plugged into.
We need to get private practice optometry doing this. It's the way to go. It's the way. Don't be afraid. You can do it. Yeah.
Absolutely. Really, truly. Well, Dr. Foster, what an amazing episode. I got to say, not only was this tremendously insightful, but I think I speak for probably many of our viewers out there. It's also very inspirational to hear, for starters, where it comes from, and the fact that you went to do this not for more money. And it seems like, again, right now we're living in a time where so many folks are just like money grabbers, right? Yeah. But you did this because you saw the opportunity to provide better care to your patients, to serve your staff and your community better. Oh, and then also in the context of it, you benefit as well with the work-life balance.
Absolutely.
And, the
and my team does it, and my family. Yeah.
Absolutely. Yeah. Absolutely. But love it on all levels.
Yeah. Thank you.
How can folks get in touch with you? Obviously, right, again, y'all, if you want to learn more about Direct Care Difference, definitely head on over to directcaredifference.com. Sign on to Dr. Foster's newsletter. I know you just launched that earlier this year.
You have a newsletter.
And if folks want to Oh, go ahead, Kara.
Oh, I was going to say we do have a Facebook page, and we're also we try to be active on LinkedIn. You can email me at the Dr. Kara at directcaredifference.com. And if you reach out to me, I'm happy to give you my cell phone number too, because any questions that you might have come up, I mean, I'm easily accessible by text. Let me know, and I'm happy to talk to anybody, because I would love to help support anybody in this endeavor. So.
Yeah. Wow.
Yeah. Thank you, Eric. Yeah,
Dr. Foster, I mean, really amazing stuff through and through.
I really appreciate you having me on today. I get excited to talk about it, and I appreciate you giving me the opportunity. So thank you, Eric.
Absolutely. Well,
and you're amazing to work with you. Eric's awesome.
So, what an awesome episode of Akrinos Access, y'all. Cool, amazing insights and inspiration from Dr. Kara Foster. We were talking all about growing a direct access optometry practice. If you'd like to connect with Dr. Foster and just pick her brain and learn more about the process, you can connect with her, Dr. Kara at directcaredifference.com. But I would say don't do that before first heading on over to the Direct Care Difference website, learning more. Obviously, a lot of really great opportunities here in modern optometry. So, Dr. Foster, on behalf of all of us here at Akrinos, thank you so much for joining us in this episode of Access.
Thank you so much. I was really happy to be here. I appreciate it. Thanks, Eric.
Thank you so much. And to all of our viewers out there, get more great practice management resources, tools, and tips just like this. Follow Akrinos across the socials. Head over to the Akrinos YouTube channel. And when you're ready to make it happen and achieve that next business milestone, whether that's starting a practice, purchasing a practice, growing and scaling your business, or looking to transition your legacy practice to another independent practice owner, head on over to Akrinos.com. We got a lot of really remarkable ways that we can help. So on behalf of all of us here at Akrinos, best wishes.